Thank you. So, good evening, everyone. Warm welcome to all on the occasion of this is a special occasion that's International Men's Day. As we come together to kick off the AHERA UNS webinar, it is truly pleasure to see many esteemed IVF embryologists, expert from across India joining us on this platform. I know, means each one of you, you are the composer and inventor in the field of reproductive science and consistently innovating and advancing techniques and contributing to the medical breakthroughs and transforming the lives across the country. We at UNS, we take immense pride in a being one of the fastest growing nutraceutical company. We decided to making the meaningful, impactful science backed up high quality products. Our infertility portfolio, which includes CoQ 300, CoQ 4, is specially designed for the female infertility. For the men's health, for the men's well-being, we have CoQ Man for the ED and libido, CoQ LC, which is specially designed for the oat cases. And with this, I'm very honored to invite today's conveners, Mr. Hetal, Mr. Siddharth, to introduce our distinguished speakers as well as founders of IR and apart from to set the context for these exciting sessions. Thank you very much. Over to Mr. Hetal and Siddharth.
Hello, good evening. Can you please start sharing your screen?
Sure. Just allow.
A warm good evening, everyone. So I welcome you all for this session, hosted by Andronet and an initiative by IHERA on this special occasion of International Men's Day. So starting with, I request Dr. Ved Prakash sir to give an insight of this session to commence this particular thing.
Thank you, Siddharth. Good evening, everyone. And as you know that today is International Day, Men's Day, and we are going to discuss men's problem, which you all know that most of the men's in even today are not ready to open their mouth regarding their problems, men's problems, and sometimes they are even don't come to show that they have some problem even for test also they are not coming. So we all thought why not to that make awareness to all the men's who are suffering these kind of problems, not that reproductive problem, other problems also. They are not sharing their problems with the that maybe physician or other friends, other colleagues also. So with that, I think we have to start with two very good lecture. Dr. Rajvi going to speak on lifestyle and what is the role of early diagnosis of male reproduction system. So let us see how that program will go, and definitely you will get some good insight, answers of your problems. With that, thank you so much and welcome again.
Thank you, sir. So I was talking to Priyal that we often forget that men's health and well-being still don't receive the attention that they deserve. So today we want to shine light on the issues that are real but rarely spoken about.
Absolutely. So when we talk about men's health, it's just not about physical fitness. It's mental health, emotional balance, reproductive health, work stress, and the pressure that society puts on men to always be strong.
And yes, this is the expectation often stops men from seeking help. Studies show that most men delay medical consultation until problems become serious. So awareness for this is the first step towards the change we need to take.
So that's why today's sessions are important. So whether it's understanding fertility health, managing stress, or recognizing early signs of disease. So knowledge empowers men to take charge of their well-being.
So let's use this day to break stigma, start conversations, and encourage every man to prioritize his own health.
Exactly. So even one person today feel encouraged to seek support or make positive change, we have made an impact. So let's begin our awareness lectures.
So I would specially invite Dr. Rajvi Mehta ma'am to start his first lecture on the particular topic. So can you please share the CV of the ma'am?
Sure.
Before going that, Siddharth, can we introduce our that coordinator and other founders?
Yes, sir. Once slides, I'll start the introduction, sir.
Yeah. So this is the convener slides.
So I would like to thank specially our conveners for this particular session, that is Mr. Hetal Shukla and Devin Patel and Dr. Durai P. So I would really appreciate your points and the knowledge which you can share at the end of this session. And as we see, the coordinators for this session will be Siddharth Moravar, that is myself, and second will be Priyal Shah.
Yeah.
Shall I share or
Yes,
Dr.
can you
Rajvi's
please
CV?
share the CV of the Dr. Rajvi ma'am?
Yeah.
So, Dr. Rajvi Mehta ma'am, she is our first speaker today. She is the clinical embryologist, convener as the SIG Holistic Medicine in Indian Fertility Society. She has immense amount of experience in this particular field, and she has done a lot of research and lot of work in this particular field. So I guess she is the right person to share her own knowledge regarding this topic. Over to you, Rajvi ma'am.
Thank you, Siddharth. Thank you, Ved Prakash, Dr. Ved Prakash, for inviting me. Firstly, it is very interesting to talk on International Men's Day, because most of the time we do talk on International Women's Day. And, although we talked for the last few years that we have a discrimination against women in India and so many measures are taken, I think in the field of infertility, there is a total discrimination against men. To give you an example, why I say that, and I strongly feel that, is that when a couple has a problem, fertility problem, the society perceives it as a female problem. It's although they do know that the male is an equal contributor, society perceives it as a female problem. Fingers are pointed in conservative society. Its fingers are subtly pointed at the female. Something's wrong with her. The couple decides to seek treatment, and they generally go not to a fertility specialist, and most fertility specialists are gynecologists. So already there's a bias for the female. A gynecologist would assess the female with ultrasound, follicular monitoring, hormone assays, maybe a hysteroscopy, the works. The men, a single semen analysis, which would be 10 microliters of semen, which would judge his fertility potential. And as far as treatment is concerned, there is so much available for the female. For the male, it is minimal. So I do congratulate Dr. Ved Prakash and UNS for taking this up, because we need to break this discrimination against men, and they are equal partners for a problem and for the solution. So with that, I'm going to be talking about a topic which to me is very, very important. It's something which has been interesting me, and as you'll go across for many years. So I'm going to talk about lifestyle factors influencing male fertility. So, when we talk about lifestyle, it's a very generic term. What do we really mean by lifestyle? And if we sit back and think, our lifestyle, it's not just one thing that changes. There are many things that have changed over the decades. And I'm sure each of us will talk about Gen Z, Gen X, Gen Y, etc., 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 and say things are different. And if we look at it, it's not only our lifestyle changes our environment, and which in turn affects our health. So it is not just unidirectional, there is a sequential effect that happens. Now, when we talk of lifestyle, how has our lifestyle changed? The work we do has changed and our food has changed. Two main things which sustain us. Now, first and foremost, if you go back in time, everything was agricultural. Even as an Indian, we used to talk about India being a primarily agricultural society, farmers, farmers, farmers. It went to industrialization, and today it is a digital life. I mean, today, if India is a power, a soft power, a lot of it is because of digitalizations and our software power. Now, along with industrialization, comes in the use of chemicals and pesticides because industrialization requires that. And then because of digital lifestyle, all that, lot of work can be accomplished by a sedentary life. I mean, today an average person does not need to go out shopping. They don't need to go and buy groceries. You have everything available with your phone. Your phone controls our life. And in fact, can you mute the others, please? Yeah.
I request Doshi sir, please mute yourself. Jignesh, can
And
you?
otherwise, we need, maybe the host can do it. Yeah.
Yes.
And otherwise, in fact, our smartphones give us reminders for physical activity. Imagine that, something which we always did. The phone says, okay, now get up and take 10 steps, etc. And how are our dietary habits changed? Earlier, one would eat what is available locally. I mean, there wasn't much of a concept. Food, when we were not economically well off, you didn't have imported food which came, it was restricted to a little few. So now there's more and more processed food. There is so much of instant foods that there are people who have no clue about cooking, and food with the Zomato and Swiggy from early morning to late night, things are just available. And sometimes if you wonder that a meal comes in 3 to 4 to 5 minutes, how has it been cooked? And does it really matter? Then we will have non-seasonal consumption. There were times where you had food during seasons and the fruit grew during that season, which means it is conducive to health. And as I already mentioned, non-local. Now, in what way would it really affect our fertility? And I would say lifestyle affects environment, and this lifestyle and the environment together affect our lives. And I call it the 6 P's, which were considered something which has improved our quality of life, is also going to be responsible for the decline of life itself. And now, what are these 6 P's that I refer to? One is pollution. I mean, there is no doubt in anybody's mind about the impact of air pollution. Initially, we restricted or considered that air pollution affects our lungs. It affects our physiology. There's enough data now that it affects the reproductive system in males as well as females. I mean, people in Delhi, possibly half of them need to have inhalers to sustain themselves. That is pollution. Second is pesticides. I mean, you want a higher yield, you don't want pests to destroy the crops. But in the process, we are using so much of pesticides and they enter the food chain, enter even somebody who is not associated with farming. And secondly, we have become so paranoid with these mosquitoes and pests that even in urban cities where there is nothing around a farm, we will have pest control agencies and we have given a contract for a year. So we will make sure I have paid for it. So let them do a pest control, whether there is a pest in the house or not. I mean, and these systems, and today with so many air-conditioned houses, closed houses, these pesticides remain in the environment, are inhaled, and enter indirectly our food chain and in our body. Then plastics. I mean, I don't think anybody who has a little concern about environment or is little environmentally conscious knows about the havoc of plastic. Plastic has been found now even in the brain, in the follicular fluids of the ovaries, breast milk, you name it, and nanoplastics are there. The 4th P is the perception of stress. It appears all of us feel we are the most stressed people in the world, as if our generations before had no stress. We are the ones who were set in the stress. I don't think we have more stress. Our ability to handle stress has come down, and what I call a perception of stress has risen up. Small thing and we feel stressed. Processed food and poor sleep. And these 6 P's do impact fertility. And being a scientist by training, I don't want to just make statements because it is conducive to my thinking. I want to show you some data which shows how it affects male fertility. Now, 1973 average sperm counts 101 million, 2018 49 million. And those of us who are working in this field do know that we rarely see men with 100 million sperm count. Male infertility, which used to be about 20%, has now become nearly 50%. Yes, not all of them have very low sperm counts, but the sperm counts have declined. Why? There is something very serious, and it is not restricted to one part of the world or one profession. It's nearly universal. Now, how do you study a relationship between what I'm calling as plastics, pollution, pesticides, etc., and male fertility. Just because something happens to be around and fertility has declined, I can't blame it onto the problem. So how do you study this? So first you make observations and you see associations. So you see associations over time, over 10 years, 5 years, and you see a kind of a relationship, but that does not indicate that, yes, this particular cause is the problem, that pollution is the cause of male infertility. Second thing is you can have a study and control group. So one group is exposed to pollutions, and this will be more animal studies, or exposed to the one of the 6Ps and the control group, and you see a difference. Then you have studies from different parts of the world and you do a meta-analysis. So it's not restricted, and you see whether this observation and the study is actually significant. Then we can study mechanisms in animal models. So you actually expose them and then you see what it is. And many of these studies have been done on these aspects. So let's look at the male. And I said right at the start, how do you study a male? Male's fertility, just a semen analysis. And you get to know the concentration or the count of sperms, the motility of sperms, the number of sperms motile, the amount they're exposed to oxidative stress, DNA fragmentation, etc. And if any of these is compromised, fertility is compromised. And now I'll get to specifically examples of these P's that I call. So first is air pollution. And we all know that with the winter, with crop burning, with the smog, there is an increasing particle matter 2.5. And there have been many association studies shown with concentration, count, and motility a decline. Now, this was a meta-analysis which was done about two years ago. However, my interest in this went way back in time. Possibly many of the youngsters here may not even have been born, but we started seeing a lot of decline in sperm counts. I mean, not decline, it was an observation that we no longer saw men with sperm concentration, and we were not a tertiary clinic. And then we said, what has happened in the city at that time? And we noticed that in the city of Bangalore, there was a massive growth in construction. And there was an electricity issue. So people used a lot of diesel generators, diesel vehicles. And one of the major pollutant of this was particulate matter, or at 2.5, which was then called as suspended particulate matter. And we found a very significant correlation between sperm concentration and particulate matter over the years. That point of time, there was not much data. So we went to the Pollution Control Board, got the data. This data was published. But however, as I said, it cannot be cause and effect. Then we were still very curious to see what is happening. And later we found that there was, then the next question came to my mind was that if we see an association and we see a group of people like the traffic constables constantly inhaling those fumes, whether they would have, increased infertility. And there was this vague thought in my mind that, if they had already fathered children and we did a semen analysis and they had severe oligospermia or something, we could have a little more evidence or little more understanding that pollution was potentially the cause. However, it is not very easy to motivate a fertile person or for a person who doesn't have infertility to give a semen sample. And we are talking of the 90s, where it was a taboo even to talk about a semen analysis in a public place. So the idea remained an idea. It never became real. But many years later, there was a study which had a similar concept in mind, and they looked at the toll booth workers. Again, being at a highway collecting tolls, they were constantly exposed to fumes. And in this people also, the sperm concentration, the sperm count, naturally the concentration is low and the volume is, and the motility were significantly lower as compared to controls who lived in the same area but didn't work as toll booth workers. And they also had higher DNA fragmentation. So later, because earlier one didn't really see an association, because pollution would infect your lungs, it would affect your breath, but how would it affect the reproductive system? And then there were many more studies which went on until last year. Meta-analysis was done with 24,000 patients or individuals, and they found that air pollutants at high level were associated in decline in sperm quality, sperm concentration, and also motility. And today, I think there is enough evidence to show that. So while we are worried about our lungs, I think we need to be more worried about also what is going to the development of the next generation. And how does it happen? They also found that there was an increase in sperm aneuploidy. And this is something, so naturally, if there is increased sperm aneuploidy, there will be poor fertilization, or even if there is fertilization and embryonic development, they may fail to implant or lead to a pregnancy loss. And this was found that there was an increase in disomy Y, disomy 21, and this was again quite an eye-opener. Then if you look, what is the potential mechanism? Like I said, the thought occurs, why? And then the animal studies were done. And in the animal study, they found that the mice were constantly exposed to diesel exhaust, which is very high in particulate matter, 2.5. And they found that these mice were exposed to diesel exhaust. Their sperm count was significantly decreased. And then they did they started doing a testicular biopsy, and then they started looking at what was the problem. When they found there was a problem with spermatogenesis, and there were double-stranded breaks which disrupted spermatogenesis and therefore also altered testicular gene expression. So surely it explains low sperm counts. So what we see in men as decreased sperm concentration starts with the potential mechanism where it is causing double-strand break and influencing spermatogenesis and testicular gene expression. So it is quite a serious problem, because if there is chronic exposure, this is going to happen. Then I go to the second P, which is pesticides. And it's for many years that one really knows that pesticides act as estrogens. They behave like estrogens, and therefore they're called as endocrine disrupting agents. And these pesticides do call, and especially if a lady is pregnant with a male fetus, then there is a decreased FSH and there is a low spermatogenesis taking place. So these right in utero, we starting men who would have an abnormal reproductive system, not physically, not anatomically, and these kids born to these women have low spermatogenesis. The third P is plastics. I mean, today, I don't think any of us can say that we haven't handled plastic or consumed something from plastic directly or indirectly. I mean, finally, what are our water tanks? They're all plastics. Rarely do you come across now iron tanks or cement. So somewhere or the other, we have something which is connected to plastics. Bisphenol A, which is now very well known to be a problem. Phthalates, which are there, bound to plastics. And these phthalates are used to improve the flexibility of plastics. So they're not very strongly attached, and you put something in there, and these will leach out, and then they are consumed along with whatever food product we are consuming. And they have found phthalates in breast milk, cord blood, urinary metabolites, you name it, as if like a blood component, these phthalates are present in a system. And a study last year showed, using Raman spectroscopy, that in a 1 liter of bottled water, there are 240,000 nanoparticles of plastic. And of the 7 types of plastic they found that PET was the most abundant, and they have found it in all body tissues. And, plastic bottles, just because of their convenience for everything, unlike glass or metal, being so convenient, we sort of depend on them. Also, how these plastic bottles are stored, because, they will also be there in the sun, etc., and contribute towards the system. And again, what is the relationship between plastics and sperms? And they found that when mice were exposed to bisphenol A at birth, for a very short period of time, it affected sexual maturity and sperm count. And adolescent exposure decreased sperm count and DNA damage. So, it is interlinked, because if there is increased DNA damage, there is bound to be decreased sperm count, spermatogenesis is going to be affected. Now, my concern is that what about the plastic feeding bottles that exist? So you are exposing toddlers and infants to plastic bottles, and all the cold drink bottles, and the food containers which are plastic, yes. And I don't know in other cities, but Mumbai, you'll have hot boiling tea put in a very flimsy plastic bag and going all over the place, and people consume that day after day, maybe a couple of times a day. The third P is the perception of stress. And like I said, all of us feel, we are the most stressed. I have to do so much work. There's so much of competition, so much of traffic. Well, if we look back a couple of generations or a couple of decades earlier, they didn't have problem of traffic. Yes, there weren't many vehicles, but they had the other problem of transport. So stress perceives, and if one goes way back in time, even Bhagavad Gita, the symptoms that Arjuna talks about to Lord Krishna about, his nerves not stable, he's shivering, he's sweating. That's the first chapter. It is talking of symptoms of stress. So everybody is exposed to same stress. Some perceive it as stress, some don't perceive it as stress, depending on your ability and capabilities. And when you perceive things as stress, we start the fight and flight response, because I see it as a stress and I need to fight it, or I need to fight. That leads to an increasing adrenaline, because we call it, raising adrenaline and adrenaline burst. Adrenaline burst leads to a cortisol release and constant cortisol. So the stress marker is cortisol, and chronic cortisol levels increased will again have an impact on spermatogenesis. So a constant perception of stress is going to have a chronic effect. And we know that the endocrine system, even simple diabetes, is found to be associated with stress. So the endocrine system is closely linked to the emotional, or what we would call the stress psychosystem. And there also used to be a science called psychoimmunosystem, where the neuropsychoimmunosystem, where each one affects the other. So the body, for sake of convenience, we call it a reproductive system or an endocrine system or the psychological system. All are closely interlinked. Nothing works in isolation. And then what is it with sperms? And there were many studies done in the past where they had donors, and most of the donors used to be young college students or medical graduates or medical students. And what they would find is that there were studies done where they had a mean sperm count or a sperm count, and sperm count during exams. And exams are known to be stressful for most people, and the sperm counts were low. And even in the field of ART, when a sample was taken for analysis, or the second or third analysis, and a sample was taken on the day of ART, sperm counts were found to be low. So all in all, there is evidence to show, and mind you, stress is not what the patient or individual says. There are many psychological instruments which actually quantify your perception of stress. So it is not a very subjective thing. There is some kind of objectivity. And then they found that men who had the highest stress levels actually had the lowest sperm concentration. So again, it's not just stress and sperms, but an entire system that comes in. And therefore, it all indicates that, yes, it does play a role. Then we go further, processed food, my next P. And in the processed food, I mean, if you've been here for a couple of decades, the kind of processed food available even 10, 15 years ago and what is available now, it has increased gigantically. And because of that, there is also an increase in obesity. And again, obesity is going to lead to its own problems. And you can see the dietary habits is getting worse day by day. And India, after China, US, India is possibly the third having the poorest dietary patterns in the world. And obesity is becoming a very, very serious issue. And it was believed that in 2015, there was some data, there were 50 million who were obese, 2025, 1 billion. And 39 million children, according to WHO, are obese. Again, sedentary lifestyle, physical activity has come down, stress gives to a flight and fight response. You want to create reserves for yourself in case you need to fight, and that leads to an increasing obesity, or at least increased in overweight. And of course, the kind of food which contributes. It all gets into a loop. And then obesity and fertility. And if you look, the impact that it would have, first is that obesity and sleep apnea, which will again disturb the sleep pattern. Sleep pattern disturbed, testosterone gets disturbed. And if you look specifically at seminal parameters, stress leads to oligospermia, because when the fat cells also secrete estrogen, this estrogen will have a negative feedback on the FSH, and therefore spermatogenesis will get affected. There is increased DNA fragmentation index and lower semen volume. And more so, even like I just said, as the fat cells produce estrogen, there'll be an elevated estrogen, and elevated estrogen will be linked to lower testosterone. Again, insulin, leptin, all the enzymes involved or all the hormones involved in metabolism also get altered. So again, the whole fat cycle changes. Now, the next one is sleep. I mean, earlier, yes, there were this group of people who had night duties, the nurses, the doctors, the police, airport workers, etc. Their job gave them night duties. Today, out of will and volition, we are not taking the chronology of sleep seriously. And now there are various sciences which talk about sleep. So if a person went to sleep with sunset, okay, at least in India, it is still a feasibility. You can't expect them in the European nations. But now the sleep instead of 9, 10, 11, 12 goes to 1, 2, 3 o'clock. Does it matter? But we know there are circadian rhythms in the body. So if one is going to alter the sleep cycle regularly, it is creating a system where your brain cells do not get time to recover. The sleep does two things. It revives memory and it also cleanses us because that's the time the brain gets rest. Here it messes up, and remember, it is the neurotransmitters which trigger the endocrine system. And they have found that consistent use of smartphone and tablet in the evenings has been negatively correlated. Like I said, any study starts with correlation studies, and then you can go for systematic study and control group, and then you can look at mechanisms in animal studies. And here too, they found that the sleep duration correlated with the total sperm total count and motility. And so I would say the lifestyle also increases metabolic disorders. People sleep late, they tend to eat late, then there's no physical activity. So it just goes on. And again, that would add to chronic disorders like hypertension, diabetes, and this in turn affects fertility. So we are getting into a closed loop. And I referred to stress with Arjuna. We are getting the human individual, and this is not restricted to men, it happens to women, but I've focused on the men. We are getting like into a chakra view, getting into a loop, into a loop, into a loop, where we are getting strongly affected. Now, one is, what can we do? First, we need to take this seriously because the effects are not immediate. It is not like you have a severe high temperature, so you become very alerted that one is sick. This creeps in very slowly, and there is now enough evidence that shows that there is an impact on on these 6 P's on fertility. We really need to take to our environment seriously. We cannot say that that there's nothing wrong with what we do and we are the ones who are going to rule the world. Nature is much bigger than who we are, and if we destroy it with whatever we are doing, unknowingly, knowingly, slowly killing it, it's going to get back to us. I think as professionals, we need to alert society. It's in these forums that we talk about it. And it's not a topic where which one can go on a podium and talk freely to public. There is still people are very shy to talk about fertility. We need to have many, many such meetings to various organizations where there are young people and alert them. And when it comes to fertility, people are going to be cautious. And mind you, along with fertility, there's data showing that many of these factors also have led to an increase in cancers. So it shouldn't be that what we consider our progress, our digitization, our ability to have, processed food to an extent that it can survive any amount of time, the industrialization, the convenience of use of plastics, so much. It is our progress for sure. But that same progress should not be responsible for our own downfall, like we've heard about civilizations being destroyed by earthquakes and floods and many other things. It shouldn't be that we have led to the subtle killing of our own existence. So thank you for inviting me. I try to do my bit alerting people with these talks, and I hope that we can do something in a small way. I think if each of us contributes, alerts 5 people, maybe a small change can be made in society. So thank you, Dr. Ved Prakash, for inviting me. I'm open to any discussion, questions that you may have.
Yes, thank you, Dr. Rajvi. It was wonderful lecture actually, and you opened so many things. Of course, there are so many things we are still using, plastic and everything we are using. So many nowadays, you can see plastic, microplastic all over our body, brain, reproductive system, everywhere microplastic is there. But still we are not able to discontinue that plastic. We have to use. Anyway, so Hetal, you prepared some questions maybe we can start discussion
Again,
from
I
there.
would say other way around. We can't get rid of anything. It's like a
Yeah,
repetitive effect. Little by little, small things. That's
yeah,
what
yeah,
I'm
yeah,
saying.
yeah. We
Ma'am,
have to.
ma'am,
Yes,
after listening you, the first question comes to my mind is कि as a layman, when should I consider that what will give me an idea कि I should have some medical advice or I should approach the doctor? I mean,
See, this is not the only cause. Like we know there are various causes of infertility per se, and most of the time we feel we are healthy unless, unfortunately, infertility doesn't have any symptoms as such, where they can. So people are now getting alerted to do a fertility testing or things like that. So if they do it early, then they can also find solutions. But I think I've highlighted reproductive health, but all these things will be contributing to other systems also. So little by little, if we can reduce these, I mean, it's sleep habits, small thing. It's not a big deal. Sometimes what do people do? You are just watching a movie or something. It's not essential. So change that. I mean, I'm not saying if you're sleeping at 3, you're going to go and sleep at 9. But okay, half an hour earlier. Everything starts in a small way. So,
Yes, yes.
and I'm sure it is old people's grandmother's advice kind of thing. All these things, get up early, etc., etc. So I'm just saying it's a small bit one can start. Nanoparticles, we are worried. Let's start in nanoscale something. It's for
and
our own
ma'am,
health.
And ma'am, when nowadays, even cancer and all, it is increasing like anything, and people are thinking of fertility preservation even in the younger age. I mean, very a minor age also there, and they also come up with questions with frozen semen. Will there be any adverse impact or over the fertility, or will there be any impact on genetics of it? I mean, any insight
See,
on
as
this?
of now, we don't see any evidence of semen freezing leading to any kind of genetic or epigenetic changes. I mean, we have been using frozen semen now for how many years? Decades. So there is no evidence to show that. And secondly, the principle of cryopreservation on semen is so simple that there is very little risk of damage as such because of cryopreservation. So yes, and when we are freezing in these cases, they are normal, healthy men in that sense. They're just doing it for fertility preservation, but they don't have a problem. But I think, yes, that is one way of looking at it. But also, one has to make other changes too. See, it's not only this system. Supposing it's affecting your quality of life and one starts to get pregnant later on in life, what is your quality of life to handle the child? So I think we need to look at multiple perspectives. So yes, it's a good thing because it's at least people are alert to that, but it will need a multi-pronged attack. Preservation, alertness, high lifestyle changes. Because see, if lifestyle is going to cause diabetes, again, that will have its own set of issues. And we call ourselves the diabetes capital of the world. So, of course,
Yes.
that's a whole another discussion. So I don't want to get into it. But basically, we do know that it is affecting the entire physiology.
Otherwise, if we see that there is people nowadays, people are more worried about the diet also. They are taking care of the. Now people are getting awareness also. But you don't think that doing too much is also going to damage things?
100%. I mean, people have gone to the other extreme of protein, protein,
Yeah,
protein, which is other
yeah,
madness. I think the
yeah.
simple advice, and I would like to go back, I quoted about stress. I would like to say that the first lesson we Indians learn at culturally is moderation. So that's the first thing. You can't be like a pendulum swinging from here to there. We are not, our lifestyle should not be like a ping pong ball. You move
Yeah,
gradually and come to a neutral state where you can sustain yourself.
yeah,
So
yeah,
I think that's a big thing. People are going to the extreme, so conscious of health. Yeah, I
yeah,
mean, we are born with our genes and we will have problems. It's not that, you're going to remain healthy right through. But this other extreme is also getting a problem, the excess of protein, excess of gymming. So
yes.
I guess one just needs to gradually move, not swing here to there.
Yeah. Yes.
Ma'am, any idea on what are the latest advancements to deal with the male infertility?
I wish we had blood. Till today, I think male infertility is being treated. I have as a strong feeling that, we are so much obsessed with numbers. So we are always paranoid that the oocyte numbers are less and therefore we have to preserve. When it comes to men, oh, there are millions of sperm. Even if the person is diagnosed as oligospermia, there's 10 million sperms. We need one. So
One.
that feeling is not there. That's what I said. The amount of research is not as required. And even when we talk of treatment and we talk of evidence-based medicine, everything, but what is happening in the male? It's a nice. We could call ourselves fertility specialist or scientist, but the treatment is a mix and match of everything.
Mix and match.
So we need to really find out and give more specific treatment. Till then, yes, a mix and match works, but then that's not science. So I think a lot of work needs to be done in this field. So a lot of things are happening, but we need to identify whom what works. That's important.
Yeah.
That's
Yes,
You know,
yes,
so
it is.
even if you're saying, say, a dietary change works or a particular, the X or Y or works, which category of people it works? So most
Yeah.
of the studies will look at a large group and say it works or it doesn't work.
Yeah.
You need
So
to identify
it creates confusion also.
confusion.
Yeah. Sometimes that there are so many drugs in nowadays. So many combinations drugs are coming and we are using, but at the end of the day, there is nothing is happening. So
Yeah.
it is because of that we are not particularly giving that individualized treatment to patient.
Yes.
We are combination we are giving to them. Just
Something will work.
like what you
Shot in
call
the
that.
dark.
Yeah, that kind of treatment. That is the big issue actually.
It's a big issue.
Yeah.
Can I ask something, Raju, here?
Yes.
Yes.
So wonderful thoughts, and I was listening very patiently. But then ultimately, I thought we have to start somewhere. This male factor has been given that due importance nowadays. We are seeing a lot of talks happening, a lot of things are happening in this favor. Would you suggest this young generation coming up that most of this MSc student or some fellowship students, they are doing everything they are doing is on embryo and embryo related things and all, but there is a lot of things to be done on the sperm parameters or related with semen or a male factor.
Correct.
So would you suggest few areas for this young generation to take this as a challenge and do some research work in that area?
Lots can be done. See, now, first and foremost, when we said we have to diagnose and we can give specific treatment, we don't know which. Now, what is our semen analysis diagnosis telling us? Sperm count and motility. If we look physiologically, it tells us there are enough sperms which will reach the oocyte. Beyond that, what do we know? Do we know whether it will cross the cumulus? We do not know whether it will bind to the zona. We do not know where the sperm nuclear chromatin will decondense. We do not know post-decondensation, whether the DNA is intact and it will trigger oocyte activation. So functionally, we have absolutely no clue. So I think a lot needs to be done because even if a person is normospermic, there may be other issues. But when we try to diagnose or something, we will use one or two of these whatever treatment modalities. We'll say it doesn't work because we are trying in an entire group. So we have to identify which category it will work. So for that, we need to diagnose better. So I think it needs to start with that. There's so much, and it would be great because see, getting a semen sample is not as difficult as creating an embryo.
Exactly. That is what I thought, that this might be the area where these people can focus and can come up with some new thing, because so many centers are there, so much of work is happening. And maybe under this AndroNet, they can take some initiative with your help, your guidance, and they can have some research work or some data collection about something related with the research we can come up with.
Happy to support these because you can see my first publication on this was 97.
Yeah, I know.
And it has been bothering me because see, as a scientist, when you start work and you notice something's happening which is not right, you can't sit silently. It's not just about having a paper. It's like something and you're keeping it quiet. That is worse than ignorance. So we really need to see what can be done. I mean, say if you're having certain supplements, maybe first thing, okay, what is there in that particular individual? A lot can be done. And I think it's time we do it. Like I've been talking to Ved about it for a couple of years now, and we've been
Yes.
discussing, and yes, we
Yeah.
can look
I
into
think,
Yeah.
Dr. Ved, we can think of doing some
No,
initiative.
definitely. Actually, we
This
already same thing we discussed with Dr. Hital also. We discussed that we have to help. We have to get help from Dr. Rajvi. We will take her on our board also as a scientific advisor for that Andronet. So she will
fantastic.
help us, and
Great pleasure.
So it will be great initiative actually, and she can help us for that thing, particular male infertility part. And Dr. Rajiv, there is one question. I think
Yes.
it is very simple, but we need to hear from you that if the water was stored in plastic bottle and we poured it into a glass bottle for a few hours before drinking it, would the plastic nanoparticles disappear?
I don't think how will they disappear.
It will not. Yeah.
But you know, there was somebody who talked about boiling. I remember some study where they say they can reduce it by boiling one paper, some random paper. We can look it up, but obviously transferring it to a glass doesn't do anything. And I remember
Yeah.
somebody talking in Delhi school. You know, they started looking at girls, PCOS. Again, that's a whole endocrine, something pretty similar kind of. They were looking at exposed to plastic, what do you say, tanks and non. And then they found the hormonal balance. But I
Oh,
haven't seen the paper, but I heard a talk from somebody from Delhi University. So,
okay.
yes. So, see, this is where the multidisciplinary approach may help. You may have
Yeah.
somebody who can tell us how to get rid of nanoparticles. We as biologists
Yeah.
possibly are lost there.
Yeah. Yeah.
Yeah.
Anything, Dr. Hital?
I think it was an excellent.
Can I ask one last question?
Yeah,
Yeah. Please,
Yeah.
please, Dr. Hital.
Ma'am, yeah. So you talked about all 6 P's
yeah.
as a common man. What is the one significant one point you will suggest to start immediately to work on that 1 P?
I would say sleep patterns. That's the easiest. Sleep pattern and processed food. See, the rest, pesticides, pollution is not in our hands as an individual. What can I do?
Very true.
I will contribute little bit, but how much will it make an impact? It will take millions of people, but processed food, perception of stress, and sleep. These 3 are in our hands to some extent. The other 2 aren't. We can't grow our own food in our own garden or something. It is out of the, forget it.
Yeah.
At least these 3 are in your hands.
Right.
Yes.
Yes. Thank you, ma'am. Thank you.
So,
Thank you.
regarding, just a minute, sir, I just want to add something
Yeah.
here.
Sure.
I think previously we were talking about something new in male infertility and the sperm parameters. So we are already running 3 programs where we are doing good enough research on it. One thing is the product called melatonin. Nowadays, many gynecologists are using melatonin in males also, up and down. But we have been seeing, we have a good data of around more than 150 patients where we are using melatonin 3 mg, where we have seen a beneficial effect as well as inhibitory effect, which we are going to discuss depending upon the ethnicity of the patient, depending upon the profile of the patient. But definitely in melatonin use, there are 2 major things which we need to see before prescribing. One is the sleep cycle and second is the screen time, which plays a very important role. Unlike the Western papers, where in each paper they have shown that giving melatonin improves the sperm morphology and motility. No, it's not the same thing in Asian population. That is one thing. Second, we are working on is betaine and aspartic acid. These are the 2 major components which we are working right now. There are certain patients who are having everything normal, but implantation is not happening. In those cases, when we are trying to give this betaine and aspartic acid, they help in a good acrosomal reaction and also helps in improving the implantation. We are working on it. Maybe in some months, we might give some data on it. And the third is the use of probiotics. We are using 45 billion probiotics like lactobacillus. There are 4 kind of probiotics which are using in infertile males, where morphology is a major issue. As a result, also DFI is a major issue. DFI has been studied by many people nowadays. So I'm not focusing more on DFI, but definitely probiotics are having a big role in infertility, not in male, but in females also. These are the three major things which I wanted to just put a light on. We are working on it in male infertility. There is lot many things to be discovered and we are on it. Okay, so just a
Very good.
small brief about the work what
Yeah,
we can
Thank you
progress.
for adding on, because
Thank
this
you. Yes.
strengthens the hypothesis of melatonin and
Yeah.
sleep is very well known. I mean, it
Yes.
regulates sleep cycle, processed food, and probiotics. So it strengthens what I'm saying.
Yes.
So, you start in a small way and you, of course, take the required drugs
So
when it
might
becomes so acute.
be more few months and we might come up with some good solid data, and that might help us in improving fertility in at least Indian population, because all the papers are of Western countries, not of our
Yeah,
ethnicity.
yeah.
Okay,
Definitely.
right.
So, one question I can ask Dr. Priyank.
Please, sir.
You told about that second one is betaine, something like that. What is
Betaine
that?
and aspartic acid, sir.
Aspartic acid. So, are you getting these individually packed kind of things, or it is
Yes,
because
yes.
most of these things are in combinations?
No, betaine and aspartic acid we get in a combination tablet, sir.
That's
Because
okay.
both these products are very important for decapitization of the sperm head.
Right.
Promotes the reaction and also helps in implantation of the embryo.
Mhm. So, any particular what do you call that? Like last one is probiotic. Any particular probiotic you are using for
Yes.
that?
Sir, I'm using one brand name called 30B Pro. Why?
30.
Because
So
it's
it is
used in
a combination or
nephro
single one?
patients.
No, it is with
No,
combination or
sir.
something.
There are four different bacilli in that.
Yeah.
And combined to that is 45 billion is the count what I'm using.
Okay.
That is giving very good response. Why I've come to that point? Because in a whole gut system, GUT, genitourinary tract, which the nephrologists are also using, we also have to use the same, because the system is the same. The embryological development comes from the same bud. So we are using the same amount. That is the reason behind it, sir. Because we can use 15 also, we can use 25. But all nephrologists are using 45. So we are also using 40. Because nowadays, you know that many people are starting using the probiotics in different diseases also. So now science is changing. We started with that probiotic also now. We are injecting probiotics. Everywhere. Good. Hello. Thank you so much, Dr. Rajvi. It was wonderful, and definitely we will do something more about this male infertility because of that Endonet. We started Endonet because of this only, because we have to create awareness about male infertility also. We are discussing all the time egg. Now we have to see sperm also. There are so many things in sperm, so we are not taking care of that. So maybe we can add something, by adding small things, we can improve our health habits and other things also. Thank you so much, Dr. Rajvi.
Thank you, Ved. Thanks.
Thank
Bye.
you. Thank you. Bye. So
Yes, go
next,
ahead, Priya.
Siddharth. Yes, Priya.
Can we have so before we begin, let's move toward the topic 2, importance of early checkup in men's reproductive health. So I would like I would like to Nakul, please can you share
Yeah,
with
I'm sharing the CV of Dr. Priyank.
So it is my pleasure to introduce Dr. Priyank. So Dr. Priyank is a very well-known urologist in men's reproductive health, and he has done various researches. We are honored to have him with us today to shed light on the importance of early checkups and preventive care in men's reproductive health. Over to you, Priyank, sir.
Thanks a lot. So I'll be sharing up my screen regarding the presentation which I have made for the early checkups which is required in male reproductive age group. Okay. Is my PPT being seen?
Yes, visible, sir. Just make it full
Yes, sir.
screen.
Yeah. Do that. Is it fine now?
Perfect, sir.
Right. Is my screen still on?
Yeah, on, sir.
Just a minute. I cannot see the presentation of mine. Just give me a second.
Yeah, sure.
Dr. Priyanka, I think you stop sharing and again reshare it.
Now it is
That will.
okay. Can you see? Can you see right now, sir?
We can
Yes,
we can
yes,
see
we can see.
Yes, sir.
Yes, sir, you have to move that slides.
Okay,
We
okay.
can first slide.
Yeah. Yeah. I
Yes,
think
yes.
now
Now, yeah.
you're fine, right?
Yeah,
Right.
visible.
Yeah. So basically, why this topic has been chosen? Why? Because nowadays we have started giving importance to men's health also, right? Because it is one of the major component which might be in back years is not been given so much of importance, but now definitely it is required. So why? So there is lack of awareness and understanding of the health issue men faces. Men do not openly discuss their health and how they are feeling, while they are reluctant to take action when they even feel that there is some physically or mentally there is abnormal, which is something going on in their body. Why? Because they think that it's not that important for them. The family members, their issues come first rather than looking to themselves. There are stigmas surrounding mental health too. Men are 24% less likely than women to have visited a doctor within the past 5 years. I think everyone will agree with this slide that males do many times neglect their health and they give more importance to their family members compared to themselves. So the key facts about men's health: men do not pay attention to their health compared to women. Men are more likely to smoke and drink. Men definitely have a risky choices and unhealthy lifestyle compared to females. They also put up regular checkups and medical care. So that is why this topic has been chosen. There are health conditions that only affects the men, such as prostate cancers, low testosterone, I mean to say andropause. Many of the major health risks that men face are like colon cancers, heart diseases, which can be prevented and treated when early diagnosed. Why I am telling about heart disease? Because the estrogen level is directly proportionate to the heart disease. That is why females are at a higher risk of heart disease compared to males. Screening tests can definitely find the disease early when they're easier to treat. It's important to get the screening test needed. So awareness related to this in the male community is very important. So aging changes in the male reproductive system. So unlike women, men do not experience a major change or rapid change in the fertility as they age. Instead, changes occurs gradually during the process that some people call andropause. Aging changes in the male reproductive system occurs primarily in the testicles. These testicle tissues in turn leads to affect the male sex hormones or decreases very slightly, may be almost minimal change or very slightly depending upon the lifestyle of the patient. There may be problem with erectile function, but this happens very slow rather than a completely lacking function. As a result, these changes are occurring so slowly. That is why males normally don't give proper attention to this kind of andropause changes which are happening in them. So, what other things which we see related to fertility? We see these microscopic changes, like the tubes which carry the sperms may become less elastic, which is called sclerosis. The testicles continue to produce sperms, but the rate of sperm cell production may slow down. Come to the other organs, like the prostate glands. With age, it enlarges in the size. Some of the prostate tissue is replaced with a scar tissue, and a condition called benign prostate hyperplasia is very common after the age of 45. This may cause problem with slow urination as well as with ejaculation. Because of the testicular change, the volume, the parenchyma which are being seen changes within the testis. The volume of the fluid ejaculated usually remains the same, but there are fewer living sperms in the fluids. I mean to say the quality of the sperm might be the counts or the morphology or the motility. Definitely it comes down. There's decrease in the test drive because of low testosterone. The sexual response may also become slower. I mean to say erectile dysfunction. So the common problems which this age group or the aging males see is erectile dysfunction, prostate cancer, and bladder cancers. Why bladder cancers? Because men age group of this around 30 to 45 are more prone to smoking also. So what is the health screening which we normally see in the ages of 18 to 39 and why it is important? So most of the men will ignore getting any type of health screening. I'm talking this mainly about the Indian population or our Indian scenario. I'm not talking here about the Western countries where health screening, I think almost annually or 6 monthly is been done by everyone. Even if you feel fine, you should still see your healthcare provider for regular checkups. These visits can avoid problem in the future. So what are the screening guidelines normally we suggest for the age group between 18 to 39? Why I have already selected this age group? Because this age group are the most dynamic age group. So any small changes which happens in the physiology of the body are not picked up very easily by this age group people. So definitely the reports will pick up this problem and we can rectify at a very early age. Blood pressure screening should be done every 2 yearly. Nowadays, blood pressure screening has become so easy that you can even do it 6 monthly or annually also. Cholesterol screening, I mean to say the lipid profile, heart disease prevention, 18 to 39 age of group can just go for an ECG and a treadmill test in order to check the health or the goodness of their heart. Nowadays, calcium score is becoming very famous. Many people in age group of 18 to 40 are going for the calcium score just as a screening or a prophylactic for the heart disorders. Diabetes screening have become a must now because of the lifestyle, because of the microplast what we are eating. Diabetes has become a very common scenario to see in a lower age group. So anyone having a body mass index of over 25, I mean to say obesity, metabolic syndrome in which diabetes is one of the components should be screened. Testicular examination is must because 18 to 39 age group, the testicular mass, the volume, any abnormalities should be checked. So we can even tell the patients to go for a self checkup, or whenever they are taking bath, they can just feel the testicle. If they feel any abnormalities while they screening by themselves, they can come and meet the urologist or the andrologist. Dental examination, eye examination, infectious disease screening. I mean to say the disease related to STD, sexually transmitted disease. That is very important, the age group of 18 to 39, because this is the age group where they are very sexually active. Also, the hormonal changes are very active. So that is must. A periodic infectious disease screening is must. Physical examination should be seen for the secondary sexual characters. Immunization. Nowadays, immunization for HPV is become very common. So any patient who is, or any male who is more than 15 years, I normally suggest them to go for at least 3 doses of hepatitis B vaccine. Definitely it gives a good response and definitely a good prophylactic vaccine to be taken. While the screening in age of 40 to 65 will be completely different. Here the focus may be more on the aging part of the testicle, on the aging part of the prostate, on the aging part of the hormonal imbalance which has been seen. So the men in the age of 40 to 65 can remain fertile. They experience a natural decline in semen volume, sperm quality, and sperm DNA integrity. Age-related male infertility can become a factor when sperm quality and quantity declines over the time. The gradual process which I'm talking about, the hormonal imbalance, the low testosterone, is called andropause. Definitely in age of 40 to 65, andropause is a condition which is the talk of the town, but none of them listens to it. Like it's like a iceberg disease. If I say andropause is like an iceberg condition where the tip of the ice, what you see, is much more smaller compared to the population who are suffering from andropause, which definitely requires a proper screening and a proper treatment. Low testosterone level, deterioration of testicular tissues and tubes that carry sperms can interfere with the conception for older men. So all these changes which we have already discussed earlier, the changes within the testicular parenchyma, the changes within the tubes, the vas which is carrying the sperm towards the ejaculatory part, even the level of testosterone, the changes which are seen in the prostatic parenchyma, the prostatic fluids definitely affects the fertility of this kind of age group males. While for the age of 40 to 65, age-related fertility may coincide with a host of health-related issues, including andropause means erectile dysfunction. There can be BPH-related issues, which is related to urological disorders. There can be chronic conditions like hypertension and diabetes. One of the most important things which have been definitely neglected by most of the community is psychological syndromes. Age group between 42 to 65 have been seen that along with andropause, having psychological symptoms like depression, mental disturbances, abnormal sleep cycle, loneliness is very, very, very common. This part of male health definitely requires a proper attention because it somehow is linked with the reproductive health of males also. So I think andropause along with psychological syndrome is very important and definitely requires a proper checkup and a proper history taking before we go forward with the treatment. It has been seen that some of the health disorders which are seen in offsprings when an age of more than 40 years, when they try to conceive, there are certain things which have been given to their offspring. So those conditions like Asperger syndrome, autism, recurrent miscarriages, schizophrenia. So this kind of things are being seen in aging age group. So such all these things can be screened and definitely a proper awareness should be given for the males who are planning for reproductive things after the age of 40. They should be counseled about freezing. They should be counseled about the DNA integrity of the sperm. They should be counseled regarding the maintenance of reproductive health. They should be counseled regarding the maintenance of testosterone level beyond the age of 40 because that is the age group when andropause really sets in. And that is the time when you really have to look upon your physical health as well as mental health. Andropause, as I have already discussed, it refers to a gradual decline in testosterone level with age, typically starting in middle age, which can lead to various physical and emotional symptoms. Symptoms in sexual part, there is decreased libido, erectile dysfunction, or decreased erection. Physically, you will see a lower muscle mass and obesity. Emotionally, you will feel more of sad, depressed, mood swings, and trouble concentrating. So it's a natural aging process in which the testosterone production in the male after the age of 30 or 40 keeps on growing down. Also, lifestyle like poor diet, lack of exercise, smoking, and excessive alcohol consumption will just increase the age. Like it will, what will lead to andropause come much more early than it is really meant for. Medical condition like chronic illness like in obesity and diabetes definitely hastens or contributes to andropause formation. So advice to men, you should know your family history very nicely. Why? Those patients who are having a prostatic cancer in their family should be screened for prostatic cancer at the early age group in the form of PSA, in the form of proper protectal examination. Exercise plays a very important role which helps in not only maintaining the physical health but even the mental health because the release of cortisol which happens during exercise, the feel-good hormone, helps you in maintaining the mental health also. Don't smoke or try to minimize it as much as possible. Good sleep. A good sleep of 6 to 7 hours is mandatory. During the sleep, try to decrease your screen time. Eat a healthy diet. Healthy diet, I mean to say more of vegan diet where you add more of sprouts. Try to add more of nuts. Try to add more of moringa, garlic, and aphrodisiac food within your diet, which helps in maintaining the testosterone level after the age group of 35 to 40. Stay at a very healthy weight. I mean to say, maintain a BMI. When you maintain a BMI, definitely it will help in maintaining a good physical as well as a mental balance. Manage your stress, which is very important in today's health. So I'm talking about the mental health. Today, not only on physical health, regarding the screening of mental health is very important. Alcohol as much as possible. Wear sunscreen. Why I am telling you, because the age group of 40, beyond 40, 45, more of sun exposure can lead to dermatological problems and also leads to skin issues also. Keep smiling. That is one of the best drug I have ever advised to most of my patients. Keep smiling. Try to take less stress. Take good sleep. Eat well. I think these 4 things will definitely help in maintaining your men's health properly. These are certain references. Thank you. So here I'll finish my talk regarding the screening part. Sir, back to you.
Yeah. Thank you so much, Dr. Priyank. It was short and crisp, and you included most of the things which is needed. And I think there is one thing I would like to know from you, that what about the semen analysis? Do you think the semen analysis can help us to what do you call that, future problems can help us, that if there is any problem can happen because of the poor semen count or mortality and everything?
Sir, so the thing is, upfrontly, when I talked about an age group of 18 to 39 years, see, upfrontly, I cannot tell any person out of the random to get a semen analysis done. But now the awareness, that is the point which I want to make. We have to get the awareness to such a level that the patient themselves are concerned about their fertility and they ask for semen analysis. Because we prescribing a semen analysis can sometimes put the patient in a very awkward position and he might ask many questions which we may not justify it. So what I say, in today's scenario, upfrontly, I will never write a semen analysis. I want the patient to earn it. And when patient demands, definitely I will go for a semen analysis. But if there is a specific history of marriage life, having beyond like 2 years or 3 years when they're not able to conceive, and when the patient comes for erectile dysfunction, I put a leading question to him. That is my routine practice. When a patient of 18 to 39 having a marriage of more than 1 or 2 years still have not conceived, I put a leading question to him: are you really planning for a kid? From that point, it makes me senseful that I gave a semen analysis, because that point of fertility might not be in his mind, and I am putting a leading question and I am making him think about it. So it makes me justified to do a semen analysis at that time.
Why I ask this question? Because nowadays so many papers are coming that they advise actually to do semen analysis early, so you can diagnose the disease which are going to come in 5 to 10 years, because of the heart disease and other problems can occur if there is problem in your semen analysis also.
Sir, I'll just change this point to some extent. Patient between 18 to 39 who are coming with erectile dysfunction are more prone to have a cardiovascular disorder.
Right.
That is why I make a point. That is why I have made a point in my talk also. I normally do an ECG, a treadmill test, and to some extent a calcium scoring in this age group of 18 to 30, because I cannot tell them to go for a coronary angio. I definitely educate them. See, when you are having an erectile dysfunction at such an age group, which is much more less, it means that you are having an endothelial dysfunction. And this endothelial dysfunction is same as what we are having in heart. So better you be alert to it. In many patients, sir, I even do lipid profile, and upfrontly I even start ecospirin with atorvastatin by myself for ED.
Right.
So yeah, that is a very valid point, sir.
Yeah. Just one more thing, because I don't know about that calcium screening. How it will help in diagnosis?
No, sir. What happens is, when you do a calcium scoring is done by the it marks the calcification within the endothelial lining.
Oh, okay. Got it. Your point.
Yeah,
Yes.
That is the calcium score which I am talking about. I am not talking about the blood report, sir. It is a CT angio finding. Nowadays, they will not go for CT angio, sir. They will just go and do a calcium score, which is hardly a 5 minutes procedure.
Yeah. Yes, you're right.
So this is a new thing which I wanted to highlight it. That is why I put a point in my talk about the calcium score, sir.
Yeah. Dr.
Yeah,
Devan?
yeah, I'm having one question. So, regarding prostate cancer, so like there are patients, maybe somebody is having a blood pressure, other is having maybe diabetes, and one is very normal, and they all are above the age of maybe 45 or at least 40. Then who should be the first person to visit urologist for the checkup of prostate cancer, or what can be the early symptoms where they feel that okay,
Yes.
they should
So, sir,
visit?
should go for it. So there is a very specific what we tell a protocol for it, sir. Any male patient who is having a family history of CA prostate beyond the age of 40 years, he should definitely get a serum PSA screening and a per rectal examination at least every yearly up to 45 year, up to age of 55, and then he can go for every 5 yearly. That is the protocol screening for CA prostate. While for a normal population who are not having any family history, but those patients who have after the age of 45 years are having the symptoms of prostate enlargement, like first symptom is nocturia. After 45 years of age, if you are getting up in the night to urinate, it means that yes, your prostate has started enlarging. Second, slowness of the urination stream means when you urinate, the urine is just dropping near your feet rather than it is going to the, to a distance. Third, you feel as if there is incomplete evacuation, means you have urinated, but you don't feel that total urine has come out. So these three, or fourth, I will say hesitancy. When you hesitate, when you start the urine, it takes some time to start the urination. So these are the early symptoms when you think that yes, the prostate enlargement is taken place and you need to screen yourself. So screening doesn't mean only CA prostate, sir. Screening will in general screen your prostate, which consists of three reports: PSA, uroflowmetry, and ultrasound. These three tools which we normally do. We normally tell routine patients to go 5 yearly checkup up to the age of 60, and then annually checkup of these three tests after the age of 60, annually checkup. That is what.
Right. Yes, Dr. Hita.
Yeah.
Please unmute.
Sorry. Sir, it was really very enlightening. I mean, very nice talk. I have a question that suppose a semen lab, andrology lab receives a semen sample with blood, and when we ask the patient, the partner, how this blood has come, so he has no idea because he has given by masturbation, and he is
Yes.
also bit stressed. So what could be the possible reasons and how lab should handle this kind of samples?
Sir, see, first of all, whenever I receive, we call this condition as a hematospermia. Whenever
Correct.
we have hematospermia, the first thing which I need to do is to rule out infection within the semen. So rather than analyzing the semen, I will send this semen sample for culture. Once I receive that report, I will give 3 weeks of treatment, and then I will tell the patient to give the sample again. But suppose after the course of antibiotic also, if he's still having the sperm, he's still having the blood in the sperm, then we will go for a test called transrectal ultrasound, sir. Transrectal ultrasound will give us a much more better idea about what's going inside, because in 95% cases it is infection, but in 5% cases there can be a stone within the seminal vesicle, there can be a malignancy within the seminal vesicle, there can be a stricture at the ejaculatory duct. So all these things can be diagnosed with a transrectal ultrasound, or if required, even with a scopy.
Okay.
I just wanted to add here one more point, as sir has asked. Seminal vesiculoscopy, which I am the pioneer in doing the seminal vesiculoscopy in India. I am the first one to be doing. I go with a scope up to the seminal vesicles, and I have also started obstructed azoospermia because of the ejaculatory duct obstruction. People normally do a transurethral resection of the ejaculatory duct, which in turn gives to retrograde ejaculation. But I normally do a seminal vesiculoscopy, which helps in giving a very good sample through normal ejaculate, and many of my patients have even frozen it, and we have got very good results of it. When we have diagnosed stones We have diagnosed strictures, and we have also treated ejaculate duct obstruction also with the help of Scopes.
Good.
Sir, would you suggest any lifestyle changes those who are facing erectile dysfunctions?
Most of the erectile dysfunction which I have seen in my practice as per the age group of 18 to 39, sir, in the initial age group of 18 to 20 or 30, most of the erections are psychogenic ED, sir.
Psychogenic, right.
Psychogenic ED means they don't have a proper concept about what erectile dysfunction is. So in
Right.
18 to 30, sir, my first tool will be to educate them. Try to decrease their anxiety. That is my first tool. If the anxiety comes down, most of the patients are treated by itself. Between 30 to 45, patient coming with ED mostly is because of their lifestyle. So most important problem is food, sir. Stress, abnormal sleep, and lack of exercise. These are the four things which I have normally seen. How if we change this, definitely things will definitely improve in this. So 30 to my age group, I normally treat ED with the help of age groups. 30 to 45 is the most common age group where I tell patients, first of all, in the morning, I always tell them to take sprouts. On empty stomach, I tell them to take the what we call moringa leaves powder, or sometime I tell them to even take this ginger and all. We have one formulation which I tell them to take it with the warm water, which helps in improving testosterone and decreasing the estrogen by nullifying the abdominal fat. 30 minutes of walking is very important. More vegan diet, decrease meat, decrease smoking, decrease alcohol, and very important, give family time. I just tell them, give family time, all your problem will be solved. Because most of the patients are having stress. They are not able to, maintain a balance between their professional and the social life. So when they start doing this and have a good sleep, most of them erectile dysfunction to some extent will improve by 1 grade without medication. That is what my observation is.
And sir, are there any signs or symptoms where I will understand that I might be having urinary tract infection, or I should be alert about it?
Sir, urinary tract infection mostly starts with burning in urination. That is one of the simple thing. And second is increased frequency, urge. There is an increased urge. And when in males, this infection goes within the prostate called prostatitis. You may even have fever with chills. So sometimes it is misdiagnosed. This fever with chills because of the prostatitis is many times misdiagnosed. So these things has to be taken into care. With the age group of 40 plus, if you are having a UTI, means prostate is the major first culprit and it has to be treated.
And what could be the dangers if these things are ignored?
Sir, if prostate infection is ignored, the deadliest thing which I have seen is getting a prostatic abscess.
Oh.
Yeah. So prostatic abscess is a very, where the things are, it becomes so difficult for the person to even sit. And he has to undergo a transrectal surgery. So it's a complicated thing, a complex procedure, and it requires a very long treatment, maybe up to 3 months also.
Sir, my last question, would you, whom would you suggest banking?
Sperm
Banking
banking.
Yeah.
You mean to say freezing, sir?
Yeah.
Yes.
Right. So my criteria for as I'm fixed. First of all, anyone who is trying for kids but who are not able to maintain proper physical relationship because of their abroad travel or because of their work shift, I always tell them, please freeze at least 2 samples, because in near future, because of your lifestyle and because of your screen time, whatever the sperm count quality I'm getting now will be drastically declined within the next 2 years. Okay, this is one of the major thing. Second, some people who are having testicular tumors, definitely I tell them to freeze. Third, I have seen in young age, sir, patients, children, boys coming to me playing footballs and all, and they get torsion of the testicles. In
Yeah.
them also, I definitely tell them to freeze 2-3 samples for the future, because torsion of the testicle somehow will produce anti-sperm antibodies affecting the the sperm production of the opposite testicle.
Sir, you said
Good.
rightly, but when you mentioned about spots and all, the thought came to my mind is that people have a thought that if we wear tight clothes, probably our sperm production might be compromised. So,
So
how
that
truth
is,
is this?
sir, that is what the awareness is not there, sir. Sir, it is the myths which people are, moving around. Like varicocele, sir. In varicocele, definitely I will tell them to wear a good scrotal supporter, right? When you are going for a very like football, cricket, kabaddi, I will definitely like to give a good support to my scrotum.
Yeah.
What I mean to say is, wearing a tight clothes throughout the day is not advised, sir. While it will compromise the pelvic vascularity, which affects the pelvic floor muscle, affecting not only your erections, but in general your urination and everything. So that is the concept which people have misunderstood.
Yeah.
People wearing tight clothes throughout the day, like, sir, 16 hours in a day, if you wear tight clothes, the pelvic vasculature is definitely compromised. And I have seen people having erectile dysfunction. I have seen having OAB, overactive bladder also. That is why Kegel's exercise, nowadays in IT profession and everywhere, they say that even if you're sitting, keep doing Kegel exercise. Why? Kegel exercise is nothing but increasing the vascularity of the pelvic floor.
Right.
Oh.
Right.
Simple as that.
Yeah. Yeah.
Right.
So there is one question, Dr. Priyanka, role of CoQ10 enzyme in infertility, male infertility.
Sir, see, CoQ enzyme is nothing but an antioxidant, a potent antioxidant which has been proved on paper, which has been proved with proper scientific reasoning. There are n number of antioxidants, but over the top list, you will see CoQ enzyme. So
Yeah.
definitely ROS is generated in our body because of the lifestyle and because of the food, because of smoking and because of our sleep habits. The CoQ enzyme definitely is an antioxidant, a potent antioxidant which improves the male fertility.
So I think most of the questions Dr. Priyanka answered. So now time is 7:20. We are coming to end, and it is wonderful experience. Today we have celebrated Men's Day also, and we discussed so many things, lifestyle factors and pre-diagnosis, how it will help us for our health and as well as our fertility preservation kind of things. So thank you so much, Dr. Priyank. It was wonderful, and definitely in future also we will take your help for this initiative started by iHera Andronet. So thank you so much. Over to Dr. Charuda Joshi for vote of thanks.
Thank you, Dr. Ved, and thank you, Dr. Priyank, and as usual, Dr. Rajvi, for giving wonderful talk and sharing the thoughts. This is what actually we are trying to get it done under this banner of Andronet, that awareness should come to the people, and this young generation which is coming up, they should also understand the importance, because for most of them it is simply an semen analysis what we talk about, but there are so many other things which has to be taken into consideration. And probably I think it is the time when you should have a super specialty andrology hospital only, where you can just treat only the male related problems, and I think that is the need of the day. So anyways, thank you very much once again on behalf of iHera for this wonderful evening. And in future, we will also have some more meetings focused on andrology. And as we discussed with Rajvi, I think we will be doing some data collection, some surveys, some analysis under this banner on semen parameters or on male factor infertility under guidance of Hetal sir and Deven sir and all other related people. And we will come up with some document that this is what is really happening in India, which is still under debate, because patient has simple one question to ask: सब कुछ ठीक सा फिर क्यों नहीं हुआ? So we don't have the answer to it. So probably we will try to find out. So thank you very much for joining this platform.
Thank you, and thank you so much, UNS for helping us for this wonderful webinar, and special thanks to Nakul, because
Thank
he
you,
is the
Ved, sir.
person who
Pleasure.
always helped me for this kind of webinar. And their specialization in nutraceutical, specifically, I know them because of that CoQ, and they are doing very great work for helping the patients also. So thank you so much, and thank you, my team, Andronet team, Dr. Devan, Dr. Hetal, Dr. Durai, and of course, Siddharth and the Priyan.
Yeah.
Thank you so much. Thank you, everyone.
Thank
Thank
you
you
so
so
much.
much.
Yeah.
Thank you,
Thank you,
Dr.
sir. Thanks
Devan.
for your
Thank you,
kind
Dr.
Yeah.
words. Thank you,
Thank
Good
you.
Dr.
night.
Thank
Priyan.
you. Thank you.